Good evening, all of you. Welcome to this webinar, Meet the Achievers, a live Q&A session. So this session is mainly planned to give you a live experience with our recent candidates who have cleared the M Endo RCS exam. So first of all, I would like to congratulate Dr. Khalil Ahmad Taha and Dr. Kruti Prashant Yagnik, who have both cleared the membership in endodontics examination conducted by the Royal College of Surgeons of Edinburgh in Dubai in November 2025. So this session is mainly for you all to share their experiences and get to know more about this exam. And for those of you who has already booked this exam, definitely this will provide a lot of insights for you to learn from their experiences. Okay. And we understand that there are some doctors who have joined and they're yet to book their exams. So that for their sake, we have planned a small intro session for those of you who don't have much idea about this exam, so that you understand it. And then probably you can interact with Dr. Khalil and Dr. Kruti. Okay, so before we start, I would like to request Dr. Sangeeta to kindly give a brief overview of how we started.
So, hello everyone, and welcome to today's session. It is incredible to see so many dedicated enrollers joining us from different locations. So, before we dive into the strategy, I want to share a quick story about why we're actually here. In early 2022, when Dr. Nasir and I sat for our Royal College exams, we were flying blind. We had the clinical skills, but we had zero guidance on the exam format. There was no roadmap, no mentor to call, and honestly, we spent months just trying to guess what the examiners wanted. We cleared those exams later in 2022, but the struggle stayed with us. We realized that brilliant endodontists were failing not because they weren't good doctors, but because they didn't have the right guidance. That is exactly why we launched ACE the Royal College exam in 2023. We wanted to make sure that no one else had to go through that period of confusion. We wanted to provide the correct guidance, the direct, honest clinical insights needed to succeed this exam on the first attempt. Since we started, we've been busy. Over the last 2 years, we've successfully trained more than 5 batches and mentored more than 30 students. We have seen the patterns of success and we have defined our training to ensure you don't waste time on the wrong things. Our next batch starts in April 3rd. Today, you aren't just getting a lecture, you are getting a structured shortcut based on real world success. We are here to bridge the gap between your current expertise and that Amendo title. So, if you're ready to stop guessing and start preparing with precision, let's get started. Here is how you're going to ace the Royal College exam. So, in this exam or in this training, we are giving 3 months of intensive training, and all our lectures and cases are focused on previously asked questions. You have mock theory and structured oral scenarios, and weekly vivas with individual feedback given to the candidate. Come join us for a great learning experience. So, if you're ready to stop guessing and preparing, now this is how you're going to ace the Royal College exam.
Okay, thank you, Dr. Sangeeta. So for those of you who are new to this journey and who are yet to book these exams, you need to understand why is it important to give this exam. Okay, what are the benefits of getting this title, M Endo RCS or F Endo RCS for that matter? Definitely, it's going to update your scientific knowledge and clinical skills. Your entire perspective of looking at a patient is going to change. And you get international recognition as an endodontist. There are several countries in which you get better job opportunities, especially in Middle East, Malaysia, and other countries. And as you all know, the MEndoRCS is the endpoint specialty training examination in the UK. So if you have fulfilled the requirements, then you could even work as a specialist in the UK. You get free access to the RCS journals, newsletters, and webinars. So they provide excellent resources for those who are interested in learning. They also provide research grants and travel grants. And if you are a member in good standing for more than 5 years, you could even apply as an examiner to join the RCS exams. And finally, all of you know, the most attractive thing that you get after clearing this exam is the title itself, the M Endo RCS or F Endo RCS, which adds a lot of value to this particular exam. Now, I'm not here to discuss in detail about how you apply for this exam or what is the eligibility criteria and things like that. It's all there. We already previously had a webinar discussing all these aspects in detail, the requirements, the eligibility criteria, what is the process and how we went through this process, and even the application process itself, step by step, how you navigate through this exam. So all these things are already been discussed in a previous webinar, and this has been recorded, and that webinar is there in our YouTube channel. You can see it here. So for those of you who need further information regarding the eligibility criteria, the exam format, or even the application process, you could please refer back to this video. And if you still have any queries, we'll be more than happy to help you. So what I'm really interested in discussing today is regarding these changes that are going to take place with these exams. Okay, so there are certain new regulations which are coming into force on September 2026. Okay, so that's the reason why this is something which we even highlighted in the previous webinar. But you need to understand that the exam is going to change. Okay, from the MEndoRCS, the membership exam, they are moving to a specialty exam or a fellowship exam. Okay, so when MEndoRCS becomes FEndoRCS, you need to have a membership before you actually apply for this exam. Okay, so MFDS will be required to enter the specialty exam. Okay, whereas those candidates or those doctors who are giving the exam now before the changes come in, even though you give an MEndoRCS exam, you will be awarded a fellowship along with it. Okay, so you will be directly inducted as a fellow of the Royal College. Okay, the fellowship will be awarded directly, even with the new format. But as I told you, you need to have an MFDS first. The exam format is going to totally change. Okay, so it's totally going to have a different format, which would be different from what is currently being undertaken. And so because of all these reasons, we would say it would be the most ideal for all of you to appear for this exam in 2026, okay, before the new regulations come in, because you need to then later prepare for MFTAs and give MFTAs, which is again a two-part exam. Clear MFTAs, and then you'll have to apply for the specialty exam. If you need to know more information regarding the new dental specialty fellowship examination, so this is already published in the website. Okay, so these changes which are going to take place from September 2026, you can visit this link and get more information regarding the new exams and the further details regarding that. Now, when it comes to the current scenario, we have two different exams. Okay, so we have a Royal College of Surgeons of Edinburgh examination, and we have a bicollegiate examination which is conducted by the Royal College of Surgeons of England and Royal College of Physicians and Surgeons of Glasgow. Okay, so this is a bicollegiate exam which is conducted mainly by the Royal College of Surgeons of England. Okay, so after you complete this, you have an option to join either RCS England or RCPS Glasgow. Okay. Now, the format of both of these exams is quite similar as of now. Okay, so now once the new format comes in from September 2026, all this would be taken out and they're going to just have a single exam, which is conducted by all the Royal Colleges together. Okay, so that's how it's going to be in the future. Now, this is the exam which me, Dr. Sangeeta, Dr. Khalil, Dr. Krudi, all of us who have given this exam, mainly because, this is the only exam which has got overseas center. You don't have to really travel to the UK to give this exam. But when it comes to this examination, The only diet which is there for this year, which they have advertised, is this one in Kuala Lumpur in April 2026. Okay. So unfortunately, this exam is completely booked. Okay. So we have many of our doctors who have already registered for this exam. Now, so we are not really sure if RCS Edinburgh is going to have a further diet before the new format comes in. Okay. There's no further information regarding this. But as of now, we have an upcoming exam by the Royal College of Surgeons of England. Okay, now this, if you see the website, there are two exam diets which is advertised. The first is an exam starting from March to April 2026. The deadline for this exam was actually 2nd Jan 2026. So again, this exam is also completely booked. So you cannot apply for this. The only option for any of the doctors who really want to give this exam in 2026 would be this exam, which is starting in August 2026. Okay. And the application deadline for this is 29th May 2026. So you have sufficient time to actually prepare your application and send it to them and even plan your preparation for this exam. Okay. So again, in the previous webinar, we have discussed in detail regarding the eligibility criteria, the exam format. The RCS England exam has got a theory section where you have two written papers of 3 hours duration each, one in general restorative dentistry and one in candidate specialty, which is your endodontics. And you have unseen cases. So it's going to be long cases. You have 6 long cases and you'll have 2 unseen cases of 20 minutes duration in general restorative dentistry and 4 unseen cases in endodontics. So that's what is the format for this exam. Okay. Again, the syllabus and the blueprint for this exam can be found in the RCS England website itself. Okay. So this is just a brief overview about this exam and a little bit of information that we wanted to share to all those doctors who have joined today. Before we actually move into the main highlight for today's session, which is your interaction with the recent achievers. Okay. So now I'd like to request Dr. Sangeeta to kindly introduce Dr. Kruti Prashant Yagnik, who will be our first speaker to share her insights and experiences from the recent exam.
Dr. Kruti Prashant Yagnik is a specialist whose career is defined by commitment to clinical excellence and continuous learning. She completed her BDS and MDS in conservative dentistry and endodontics from Gujarat University. Dr. Kruti's dedication to excellence led to her prestigious induction as a Fellow of International Theory Culture Academy, USA. Most recently, she earned the membership in endodontics by the Royal College of Surgeons of Edinburgh. Furthermore, she has presented numerous scientific papers at both national and international conferences and has published research work in reputable dental journals, making significant contributions to the field of dentistry. Currently, she works as a specialist endodontist at a leading multi-specialty hospital and as a consultant for various premier practices in and around Gujarat. So I personally welcome Dr. Kruti to this session.
Am I audible?
Yes, you
Yes.
are audible.
So thank you so much, Dr. Sangeeta ma'am, for the kind introduction. Good evening to one and all present over here today. First things first, I would like to thank Dr. Nafit sir and Dr. Sangeeta ma'am for inviting me today to share my journey towards the fellowship in endodontics Royal College of Surgeons, Edinburgh. So today, like my journey had to for this royal journey has been amazing so far and with its own set of adventures. So I'm here today to share few insights that would give you some rough idea that would certainly help you to navigate your royal journey. So in interest of the time, let's just dive in. So starting with the preparation, I would say that it has already been mentioned in the previous modules that for the Royal College of Surgeons Edinburgh and the England, they both have the respective blueprints which has been available. So I would suggest each and every one of you to kindly go through it, and certainly it would help you to get some idea and prepare very efficiently. The most common question that I have been asked by my colleagues, and personally, even I had the same question before commencing this journey, that how to, how much time does it require or to prepare for this exam, or how much do I have to invest before coming and preparing for this. So, as per my experience, I would say that for any person, any clinician who is working full time, ideally they should start preparing for this exam 6 to 8 months before taking this exam. And anyone who is doing part time work, they could ideally just start 4 to 5 months before taking that exam. So it's basically, why am I saying is that you should certainly, the volume of the content that you practice is also important, but the repetition of the content is very important. It plays a vital role. So ideally, when you give some time, you would have some time at the back near to the exam, at least 1 month for your revision. So, and the second question that I have been often asked, that how do I start my preparation? So for me, I have personally divided the days and have assigned few days and allotted the topics. And I would take 4 hours out of my day. That is, I would divide it 2 hours for the written component and the 2 hours for the oral component. And you can assign whichever topic you want to do. So, but ideally, however, we all are clinicians at the end of the day, and ultimately, we all get tired. And on the some or the other day, we could, you know, just burn out blooms. So I would say that start making the note the moment you start preparing. So even on the days when you don't have the time, when you don't have the energy to go through the articles, you could just refer and revise it again and again. Even if it is for 15 minutes, the consistency is the key. You have to be disciplined enough to go through the data again and again. So that is one of the key that would ideally help you. And moving to the written part, I think we have to move to the next slide. Yeah. So now coming to the written part, as already mentioned, there would be multiple short questions. Okay, so there are many questions, like almost two papers that is divided, and you would be having 10 questions, which would ideally be having multiple sub questions. And in the written part, the time is your precious commodity, I would say. And I have personally felt that the strategic errors which have been made by the candidates is that they rely on the general clinical knowledge only. Of course, it's important, but that is not only the way that you could, help you in the written part. They usually rely only on the endodontic component, but as a specialist, this is something which, even though it's M endo or F endo, they expect it that the specialist should have the knowledge of the different specialty. For example, periodontics, prosthodontics, and recently I have observed the trend in my exam personally. There were a lot of questions from the orthodontics as well. So overall, you should have a holistic approach, and most of it, general clinical knowledge does help, but in this kind of a component, usually theoretical component is also important. They usually tend to ask a lot of theory questions, like what is the setting reaction of MTA, advantages, disadvantages. So all these things you have to go through and cram it up a little bit. And during the exam, I would say that you have to be very quick and concise. What happens generally is that, let's say, one of the question you didn't find the right thing or right answer, because it would be a clinical based question. So you need some time to think upon. I would suggest that rather than giving more than 5 to 10 minutes to that question, you should generally move to the next question and then finish up the paper, whatever questions you could answer, and at the end you can always circle back. Because if you don't do that, then you would have, the paper would be certainly very lengthy, and trust me, it's very lengthy. It's very difficult to finish up on the right time. So I would suggest that have some, put the points very concise and precise. Let's say there would be the questions which would be ranging from 2 marks to 14 marks or something like that. And in that, let's say if you have been asked the question of 2 marks, I would suggest that just write the 2 points and concise it very precisely and just move to the next question rather than elaborating it as per our Indian education system. And lastly, I have seen that people usually, love to learn the fancy thing, and we have been doing and learning all the evidences again and again. But I think the main thing is that we should not forget the basics, because if the basic points are missed out somewhere, then it's not going to be accepted by the examiners. So that is something you have to follow the guidelines. For example, there have been given the guidelines of the vascularization, revitalization. So you have to know that how do they perform the procedure, and that is when you have to follow that rather than going through your own anecdotal evidence. Um, so that is it. I think recently I have heard that most of the times they are being asked to, draw the RPD design and all these things. So I would also ask you guys to perform a bit of practice, have the practice regarding the drawings about TMJ or something, which is very often you could see in your papers. That will certainly help you and not put you in surprise at the end. Okay. Uh, Now coming to the oral structured vivas. So oral structured vivas are designed in a way that they want to assess that the patient is safe with you. They want to assess that you are a safe specialist who is following the evidence at the right level. And for that, especially in the short cases, you have to think on your feet, and you certainly have to synthesize the information very instantly and reply. So at that time it is likely to put up a pressure on you, and you tend to go directly to the diagnosis or the treatment plan, and you miss out the major points. So what I would suggest you guys is that you can just follow the scanning protocol initially. Whenever the short cases has been provided, you should start looking at overall view. That is, if the clinical picture has been given or you have the radiographs, just talk about the view that has been provided. Talk about what you could see on the clinical picture. What view is it? You could see the evaluate the soft tissue, hard tissue. Talk about your findings, and then there is very less chance that you could go wrong by following this ritual. Okay, so follow that template. Next point is anatomy and pathology. Whenever you are guys have been provided with the radiograph, I would say that never miss the anatomical landmarks. For example, you have the zygomatic arch, floor of the maxillary sinus. We know that you all know that this is the floor of the maxillary sinus. The examiners also must be knowing, but that is something you have to talk about it. You have to mention in your findings. Similarly, in the clinical picture, if you see there is a white lesion, there is a ulcer or something, then you have to talk about it, because specialist is not only looking at this particular tooth. According to them, specialists must be having a holistic approach. They see the patient overall. Navigating the nudge, what I mean by that is, let's say you are answering your viva, and somewhere in between the examiner jumps up and says that, okay, are you sure about that? So that certainly often means that that's the nudge that you have missed the clinical detail. And at that time I would suggest that don't get panic or flip flop your answers. Maybe you can just talk about that, okay, over on the detailed inspection of the distal root, I could see that there is a significant apical curvature, and maybe it requires to selection of the specific file taper, something like that. You can just talk about it without getting without getting anxious or just panicking at that time. Next point is defending the gray areas. In endodontics, we have a lot of debates which are going on, like single visit versus multiple visit. Then you have whether to select the revascularization or whether to select go with the apexification, right? There is a lot of paper which has been published. So at that time, I would suggest don't be dogmatic. What would help you at that time is the evidence that you guys have been reading throughout your preparation. So, evidence is going to anchor your answer. Whatever is your preference, you can always, take the help of the evidence and say that I would be considering revascularization in this case because looking at the image, I could see open apex appears to be more than 1 mm. So according to Anderson, this is something I would be, following this protocol. So basically that is where the evidence plays a major role, and that's why the people, continuously ask you to go through the papers again and again. And lastly, the point which has been mentioned is managing the spirals. So I think this is the very important point which I learned during my preparation, was that even if one of the station, the way you have expected that it should go, if it doesn't go as per your expectations, then rather than allowing the snowfall into the disaster, I would say that just take every new viva as a new opportunity, and that certainly will help you rather than getting carried away with the same thing again and again that you have not performed well, because this viva is going to be an overall assessment. Not one viva is going to determine your future or your results or any of your marks. So you have to give your 100% in every question, every viva question that you are giving. And lastly, think like a specialist, not like a candidate. That has been inculcated over throughout my training. So what I mean by that is, of course, we all are specialists, and but when we are talking about the treatment plan or something like that, we just say that I'll do the root canal procedure, right? But over here, you are not supposed to say that directly. What the specialist must be talking about is that I would initiate the endodontic intervention after assessing the restorability. So you cannot be uncertain. Endodontist or any specialist would not directly jump up to treatment or, perform with the guess game. The specialists are always certain that what they are getting into, that whatever treatment they are selecting. So be very sure when you are answering, and maybe whenever you guys have a question, like you could see that there is a developmental anomaly or something, and you have the dense invagination or resorption, and you could see. But whenever it comes to coming to the classification or diagnosis, you can always say that I could see there is a dense invagination, but maybe just to get certain, perhaps I would like to take the CBCT to get the confirmatory diagnosis. So that is how your approach should be, and that is what the specialist must be doing rather than guessing around. Okay. And what I would say is that what I have learned, that the person who figures out how to enjoy the process will always beat the person who is just tolerating it. They would be putting the same hours but different energy, and you could see that the complete different results are around, right? So when you find to a way to love the grill and grind and success, stop being the chase and start following you. Eventually, I have forgotten that, I don't even remember my struggle. It's just I now see it as a growth. So that is where the mentorship plays a very important role, that it converts your painful grind and grill into a path of growth. So I would like to take this platform, and with the heart full of gratitude, I would like to thank Dr. Nasir sir and Dr. Sangeeta ma'am for being an amazing mentors. And I would definitely recommend this training program to any of the specialists who is taking up this exam, knowing that they have been an amazing, knowledgeable professionals, and they do have a visionary leadership. They do help their colleagues a lot. The course outline is very much structured so that you get a thorough understanding how should the preparation be, and they do take the accountability. Also, they are highly approachable. So whenever you guys have a queries, they are always there to help you out. Even if amid all the busy schedules, they would be taking out the time and coming back to you with answers and helping you out. So I would say that this exam requires the right guidance to pass and achieve the success. So I definitely recommend this to highly extraordinary individuals for your preparation. And lastly, best wishes to each and every one of you. I think the future self is already cheering up for you guys. So if you guys have any doubt, you can reach out to all of us whenever you have any queries. I would like to, ask ma'am to introduce Dr. Khalil further.
Thank you so much, Dr. Kruti, for your valuable insights. I'm sure all the doctors here might have really gained a lot of information and experiences from your words. Now, I would like to invite my dear friend, Dr. Khalil Ahmad Taha. He's a specialist endodontist with strong academic distinction and international clinical experience. He graduated from University of Kerala with rank 4 and completed his MDS in conservative dentistry and endodontics from the Kerala University of Health Sciences with rank 2. He has successfully completed the M Endo RCS examination and is awaiting his fellowship with the Royal College of Surgeons of Edinburgh. He served as an assistant professor at government dental colleges in Trivandrum and Calicut before relocating to the Kingdom of Saudi Arabia, where he currently practices as a specialist in endodontics at the Qasim Health Cluster. Dr. Taha holds full dental registration with the Kerala State Dental Council of India and also the General Dental Council in UK. And he's also having a specialist registration with the Saudi Commission for Health Specialties in Saudi Arabia. His professional achievements include the prestigious life membership of the Student Clinicians of American Dental Association for undergraduate research and the Shastra Puraskaram Science Award and Scholarship for the best postgraduate research. He's actively engaged in clinical teaching, research, and publication with work spanning endodontic treatments, dental material evaluation, and complex root canal management. Dr. Taha also has collaborated with international researchers and has published in high-impact journals, including the Journal of Endodontics. With these words, I would like to welcome Dr. Khalil for this session and request him to share his experiences.
Am I audible?
Yes, we can hear.
All right. Good evening. It's nice to have every one of you here in this platform. I'm very grateful to Dr. Nasil and Sangeeta for giving me the opportunity to come and talk to all the candidates who are planning to sit for the exam in the future. So you had a brief idea about what is going in the ACE platform. So they have invited me to give my insights on what I have had as a personal experience in this journey. So contrary to what Kruti has said, my journey was all the more different. I was actually, I just took up this exam on a wartime footing. So like Kruti told that it's always good to have started pretty earlier, like around 6 to 8 months ahead, and that is the best way to prepare for any exam. But my journey was a bit different. So as always, I usually start taking up things seriously once you have the exam date in hand, and I'm pretty much sure almost 99%, or rather over 95% of people does the same. Unlike there are people who are really studious like Kruti, who takes things much earlier. Anyway, let's talk about how I travel this journey. So my focus was basically, rather than aiming at the exam or the tag, I was more concerned about updating my knowledge. That was my priority number one. So because since leaving India, I was almost into clinical practice for say around last 7 years. So I had a tiny bit of attachments elsewhere where I was doing some academics as well, but mostly I was into clinical practice, doing advanced endodontic procedures here in Saudi Arabia. So the problem I felt was after having continuously taken up only clinical practices, you tend to slightly move away from updating the current guidances, current knowledge, and whatever is new. So that was a point I decided that I should take up something really challenging that would challenge my knowledge and help me prepare for something. So that would inherently improve my knowledge base. So at that point, that was the point when I contacted Dr. Nasil, and he was very kind, and he was very out to help me uh, in a very strategic plan. So that was the time I thought of taking up this exam. So probably since my MDS exams around 10 years back, I wouldn't have sat and studied on a specialty level like this. So it was challenging for me at first. But still, when you have the proper guidance and when everything is very simplified and it is broken into bits and pieces, and you only have to focus on one bit at a time, things become very easier. Take my word, things become very easy actually. So my only focus was just to stick to what they say, just stick to what the training curriculum provides, just learn that and make sure that I do not make any mistake in whatever that they have asked to study or whatever homeworks that they have given to finish it up. But still, at the end, I couldn't manage to give some of the exams, the mock exams, but I was lucky enough to manage that because I had all the support from both Nasil as well as Dr. Sangeeta. So there are some aspects that I'd like to tell this, like it's always a good idea to start pretty early, so that especially for people who are out of academia or who are into clinical practice for a long time, it's a good idea to start reading a bit early so that they come into the group easily, so that then they can take it on from there. So another aspect would be if you learn something, the good idea is to start applying it. Say, for example, if you come across a periodontal condition or a patient with periodontitis, the one sure shot question you can expect is a classification of the periodontal condition according to the recent guidelines or the recent classification. So whenever you get a perio patient, even though you are an endodontist and your focus is only to look into the endo part of the case or endo part of the treatment, but still it's a good idea you look into the perio aspect and you try to classify yourself what classification this would come under. So 1 case, 2 case, 5 case, 10 case, then down the line, there is no chance that you are going to miss that. So that's a one sure shot question you can always expect on this exam. So the number one thing is to apply what you learn. And then whatever little bit of information you gain or little bit of reading you do, make it a point that you revise it. You revise it again, and then you revise it another time. So the more you revise, those things are not going to get out of your mind. So my point is, like, rather than trying to grab everything, try to grab little pieces, and whatever pieces you grab, make sure that you have grabbed it well, and make sure that you grab the right piece. That's very important. So that's the time. That's what these people are here for. They will guide you to look into or to read to the exact material that you have to read or that you have to look into for preparing this exam. So more importantly, rather than knowing what to read or what are the materials with which you have to prepare, uh, the bigger impact would be to understand what are the things that you don't want, so that you don't waste your time. You just stick on to what exactly is required for the exam and you prepare it accordingly. So especially when for those who are planning to sit the exam in a very short time or who have very limited time. And you should always ask more questions, like whatever it is, whatever stupid question it is, especially when you have the interaction platform or when you have the sessions going on, you should ask. And even if you know that it's the most stupidest of all the questions, you should ask and still manage to get an answer. So that was one thing I kept on doing, especially during my vivas or the interactions after the vivas or during the feedback. And I think rather than me referring more, Sangeeta and Nasil would have gone back and referred more to answer my questions. That has happened even right on the night. I don't say the day, on the night before the exam. Even that was what was happening, and more than how much I was tensed about the exam, my mentors were more tense rather than me. So you should keep on asking more questions, especially when it comes to cases and case discussions, because the way one person thinks may be entirely different, or the plan that one doctor has or will be entirely different from what the other person has. The point is not about asking question and getting the answer, but the point is in finding the exact guideline or the exact justification for why you chose to take that path, or why you chose to make that decision for that particular treatment. And that is what the examiners really want. And rather than beyond the examination purview, that is what the best that we can give to your patient. So ultimately, the point is not about the tag, or not about the fame, or not about what is coming after that. Being a clinician, our ultimate goal is to be giving whatever is that is best to the patient. So many of the questions, or many of the Viva questions, or the long cases and the short cases that we have discussed, at the end of the session, when we were interacting, like when they were giving the feedback, we had pretty much good discussions about the cases, and that was really very interesting. And the next thing would be uh, whoever who are in the program, or who are planning to come into the program, you should always ask to seek help and guidance. Uh, it doesn't matter how much senior you are, how much experienced clinicians you are, or how much junior you are. Uh, the best thing I found about learning together with Dr. Nasil and Sangeeta are that they were always ready to help and give you guidance. So Sangeeta, if you talk, she's pretty much junior to me, and Nasil is almost of the same experience with me. But still, I think rather than to Nasil, Sangeeta was more helpful in finding up more information and guiding me, and so I was not like hesitant to ask help and ask for guidance, and they were very helpful in that regard. So all these small things have added up to giving the exam in the best possible way that I could, and that would have brought out the best result. And if you asked about my beginning, yeah, like I was always very skeptical, doubtful, and very. I was having a lack of confidence in sitting the exam initially, but once when the preparation started, yeah, things started to change. So this happens with everybody, and the more you try to learn, and the more I mean, the number of weeks that starts to go on, things when gets to start become more difficult, then you become more doubtful. So then you may start to lose your confidence, but this is all normal. This is very normal actually, and that was the point I told you again. You go back to them, you ask for help, you ask for guidance. They're ready to help you out anytime. And consistency and discipline, yeah, it does matter a lot, but if you are not very much disciplined, okay, you can take my word. If I could make this, you all can make that also. All right. Then, regarding the exam aspect, Kruti has discussed very well. She has given a good outline, a good idea about how to prepare for the written exam and what you can expect during the exam. So I'll just brief you about what happens during the day of exam. So how many of you are giving the exam in April? Um, any? Yeah. Is it okay if you can have your cameras on? Maybe we can. I don't have any formal slides to discuss with you, so I'm here to pretty much interact with you. You can ask questions to me. Kruti will be also there to answer. So if you have any specific questions, it'll be easy for me to I mean, give you the answers as well, how to tackle those. This is a very close group, right? Had like how many with 20 candidates. So if you can, um, Yeah, Dr. Tina, then I think George is there.
Yeah. Yes, yes. It's my daughter's name
Is
actually
that,
on the screen.
yeah, George.
Hi.
Yeah, how are you, George? Good
Good,
to
good,
see
good,
you.
good. Good to see you again
Then
here.
I see someone called Dr. Samad. Amina is there. How are you, Samad? Good?
Yes, hello, Dr. Taha. I'm good, Alhamdulillah. How are you?
Yeah, I'm good, alhamdulillah. So, Nitu is
I'm
there, I know
just gonna turn
her.
my
Nitu
camera
is...
off. I'm actually driving. I'm gonna turn my camera off. I am
No
listening to
problem,
you.
no problem. Yeah, no problem. If you have any questions, just ask. Both of us are ready to take up any questions, and especially those who are sitting the exam. I know you would be like 2 months down to sit for the exam, and you should be pretty much stressed about the exam. And okay, anyway, if
Do
you,
do the sorry,
yeah,
Doctor do the
yeah.
does Edinburgh do an April diet?
I'm sorry. Your voice is breaking.
I'm asking, does Edinburgh do an April diet like
Edinburgh
in
do.
Edinburgh?
I think Dr. Nasir has already mentioned, like the sessions for Edinburgh are already closed because their April session is in Malaysia, and further to that, they haven't announced any dates as of now. Only I think UK, RCS UK has announced the session in August, right?
Yeah,
England.
it's not RCS England.
Yeah, RCS England, yeah.
So there's no UK venue for the April attempt, right?
No, I think.
Right, right. Thank you.
Hi, Dr. Khalil. I would like to
Yeah.
ask about the written paper. So, is it
Mm.
very less time? I mean, is very crammed for time, or is there enough time to write properly? Like, do we have to be really fast, and
Uh,
concise?
He's the
I know
best
Sangeeta has
person to
already
ask.
started smiling.
He's
I know
actually the
Sangeeta has
best
already started smiling. So, and
in the exam.
probably Amina would also be knowing about how I start my
Uh, that
like to have an cooked up opinion, cooked up answer.
I think we missed your part of your answer because I think the audio cut off at
Okay,
the yeah.
okay. I'll give you my honest opinion. Okay, so especially for people who are not into writing so much for a pretty long period of time, you really need to practice how to write. Okay, because most
All
of
right.
us are just the only writing or probably the only thing that we do is enter the case notes.
Mhm.
That's what's been happening for almost all of us. Yeah. So on the day of exam, you can expect to get the worst available pen on earth uh, to write the answer sheet. Okay. So if possible, go get a 0.7 mm diameter ball pen and try practicing with that. Okay. And that 0.7 mm and that 0.5 mm will make a bit of difference unless you are a 0.7 mm ball pen fan. Okay. So the point is, when it comes to the theory paper, you have two papers, one in the morning and one in the afternoon. So that day is going to be a bit tiring. It's like a 3 hour paper in the morning and 3 hour in the afternoon, and you probably will have an hour's break in between. So you can go grab something quick. So spike up your blood sugar so that you can gain back the attention. So, the thing is, this entire 3 hours, your brain is working and your hand is working, and both should be very much coordinated. Okay. And in paper one, I think we had 9 questions with a lot of sub questions. And paper two, we had 11 with a lot of sub questions. So altogether, uh, maybe you will have pretty much to write the entire 3 hour span. Got it?
Okay.
So the challenge, the mistakes I made, and what you have to look into detail is like number one, most of them are case scenarios. So you may have pretty much a paragraph to read on, say like 10 to 12 sentences, in some cases even longer. You may have artifacts to look into. So there may be radiographs given. So you may have to go read the radiographs, try to identify what's in there, what's not there, or based on that, how it works. And once you have your first question, sub question, you tend to write on whatever you know. And this has happened with me. And then you go to the second question, you already find that the third statement that you have written in the first question is the answer to the second question. So that means you are again rewriting what you have already written. It's an absolute waste of time. Okay. And even if you have mentioned it earlier, that is not going to get you any more mark. So they have very clearly written on the cover sheet of the question paper, like if a particular question carries only 3 marks, they expect 3 definite points, no guesses. The 3 definite points for that question, for the answer to that particular question. So there is no point in writing anything that you know. You have to stick to the point, and that's going to fetch you the mark. And they have also mentioned very clearly that even if you write 5 statements for that 3-mark question, they're going to give mark only to the first 3 statements. 4 and 5, they will not be marked. So there is no pointing in writing whatever you know. Say, for example, what are the advantages of MTA? So you know what all are the advantages. So if you know 5 points, you write the best 3 in the first 3 slots. So you get the 3 marks, done. Move to the next question. So the mistake I made was whenever you get a question, you read the question completely, you understand what it is about. Say if it is about a mishap, or if it is about a sodium hypochlorite accident, automatically your brain will tell you what are the questions that are going to come down, what you can expect. And just skim through all the sub questions, so you know what are the questions that are coming up. So you will explicitly, you will confine your first answer to what is required. Done. Alas. Okay. So then you move to the next question. You already know this is the next question. So what is the management? Identify or explain the picture. Next is what is the immediate management? So and the next is what is the long-term management? What is the follow-up? So it all goes in a systematic manner. Usually it goes in a very systematic manner. So and again, the next thing is to save time and to get more marks. You should always look at the questions which carries more marks. Can you hear me? Hello?
Yes, yes.
Yes, yes.
Hello?
Yeah, we can hear you.
Yeah, okay. So the thing is, if some question carries 4 marks and there is another question that is carrying only 1 mark, and you are out of time, make sure that you write the 4-mark question first. Because anyway, you are going to get 3 marks out of that 4 marks, rather than spending more time to write that 1-mark question. So these are the small mistakes that I made, that I felt that I could have corrected. And again, time is a big thing. So especially for us who are not into the constant mode of writing, time is a big thing. So you have to constantly learn to practice. And now coming to the honest part of the answer, out of say like 4 mock exams or 4 theory exams they have conducted, I have written only one theory paper. Okay, but I did it in the best possible way. So just exactly like what Dr. Nasil has asked me, with the perfect timing and just the exact way how you sit the exam, I did it. There is no looking up or just opening the book next to you and looking at nothing. Whatever I knew, I wrote. That's it. So obviously, you still have to practice writing so that the exam will run very smoothly. Say, for example, if you make a mess during paper one, the point is not carrying it with you when you go for your break. Whatever is done uh, on paper one is done. You can't change it. So your focus should be on your paper two. So don't go about thinking what mistakes you made or then how much mark I will get. No, there is no point in that. The point is in trying to look what is ahead rather than what was behind. So you don't make the same mistake in paper two. So that is my experience about the theory. So the take home point in theory is, one is you have to start practicing. If you're not in a constant state of writing, you have to write. And all the mock exams, try to give it, because I already told you, I just had only 3 months to prepare, and I had a lot of other things to worry about towards the end of the exam. So you never know what will come as an obstacle ahead of you. So when you get the time, that's the right time. You prepare at that point of time. Because this has happened with me. That's why. Because the week before exam, I had planned about the exam. So things like that can happen. So make sure that you prepare well in advance. And the second point is, I made it a point not to miss any of the lectures. However busy I tried to make the point that I attend all the lectures. And I gave all the hello, I think, yeah, there is some problem with the internet, I think.
Yeah, we have missed some points.
Yeah, where did you miss out? Like
actually, the last part was not clear because something was wrong with the connection. I was not able to hear you. The last few.
okay.
Yeah.
The thing is, what I made sure was that I made sure that I attended all the webinars. So that is the point where you can interact freely. Then the second one was I made sure that I attended all the vivas and I had good discussions with them at the end. Because even if you don't get time to go back to the feedback session and learn, uh, the very, very simple mistakes that you make, which your mentors correct you at that point of discussion, you're never going to forget it. This is not for the sake of the exam alone, but this is also for when it comes to your patient as well. Probably that might be the thing that you have learned in the past, you have forgotten long back, and you still know, but you can't reproduce. But once you have the same thing on the Viva session and you have missed it out and that you have been pointed it out and corrected it, then no, there is no way you're going to miss it out again. So attending the Viva session, having a good discussion is very important. Then revising is also very important, because I couldn't follow all the papers that they have given, the entire folders. No, I couldn't, because I told you my preparation time was pretty short. So I made it a point that whatever they have taught, I have learned it very well. So even if it is implant, say for example, if it is an implant, like I'm not into implants. I know only the very basic of implant, and whatever the implant that they teaches you, that's pretty good enough. That's pretty good enough, and that's, even if you say for the exam, you say okay, my idea is to rehabilitate it with an implant. They may ask you like, what is the basics, or what is the space requirement enough for the implant? What do you think about the bone quality? So you can always say, I will refer to a specialist because I'm not into implant. That's not wrong, but always expect at the end of your answer, another question is going to pop up, like, what do you think the specialist is going to do? But when you make a comment, you should make sure that at the end of the comment, something else is going to pop up. So be prepared for that. That is another thing. So that is about the theory and the basic preparation. And what Kruti has to say, Kruti, if you have to add on something to that.
I think pretty much you have talked about it. The only thing is that,
Yeah.
like you mentioned, that since you might not be, writing a lot because I passed out 2 years back, so I had the, command over the writing, so that certainly helped me with the paper. But I think you have to be very precise and concise with whatever questions are being asked. So what I would suggest is that go through the question, and for example, there would be a case scenario which would have been given, and there would be multiple sub questions which would have been provided. So rather than directly just reading up the first question and writing it down, just go down and read what other questions are regarding that case scenario. Pretty much you will get a better idea that what you have to answer and how much you have to write on the first question, so that you don't take a long time to writing, a lot of things and elaborating same things again and again, because you will be having similar case in the second paper, and there would be the same answer which you would be having to write it down. But I would suggest that at that time, if you would have written 2 points, you could rephrase another 2 point in a different way. So that would be the one key that you can, work upon, that would help you. And writing, I would suggest that whenever you write down, just make a point. So there would be a space provided below the question. So just analyze that space, that based on that, you will get an idea that, for example, if there is a treatment plan which would have been given, that they want you to write down the treatment plan, then there would be pretty much, one stanza place that would have been provided. So you'll get an idea immediately that, they don't want to elaborate the entire revascularization. They just want you to write down the few points. So that small basic things would help you to understand that how much you have to write at that time.
How many days did you have this exam? Like on a stretch, did you have?
Yeah, it is like it is. Usually it is either spread across 4 days or 5 days. I think the last year or the year before last, the Dubai session was spread around 5 days. For us, it was spread around 4 days. Okay, so I was coming to talk about what happens on the exam. So a couple of weeks before the exam, you will get a very detailed note on which batch you belong, what are the timings that you have to attend for the exam for each session. Okay, so this is not an exam that is conducted entirely for the endo. So this is an MRD exam. So you have candidates from M Perio, M Endo, and M Prosto, and all of them are giving the exam together. So the guy who is behind your shoulder need not be a guy from Endo. He may be a Prosto candidate or a Perio candidate. So all in the Dubai session, all these candidates were, I think, how many halls were there, Kriti? One or two? Only one hall was there, right? Yeah, only one
Yeah.
hall was there. All these candidates were inside one hall, pretty much around 100 candidates. And their questions will obviously be different. And the theory questions will be different. So once the theory part is over, next is when it comes to your short cases and long cases, usually what they do is they have 4 short cases and 2 long cases in one day, or they can mix and match in any way. Okay. So there will be a morning session and there will be an afternoon session. If it is a short case session, you have a morning session with a short case, and then you will have a break, and then you have your long case sessions. Okay. And these 4 long cases will be spread across 2 different days. So what happens is, out of this, if you say, for example, if you have 60 candidates altogether, they may divide it into 6 groups, say around 10 candidates of each group. Okay. And these 10 candidates will be given one particular time. At that time, they have to report to the desk. They have to put their signatures or whatever. They'll make sure, give their attendance, and they will be provided with their badge or your roll number or whatever it is, candidate ID, candidate number. Rest everything you leave behind in that desk. And then they will be taken to a room where they will be given all the facilities to have your basic, like your food like your snacks and your beverages. You will get coffee. So make a point that you don't drink too much of coffee. Uh, and you will have your snacks there. And all these candidates will be placed into quarantine. This is called the pre-quarantine. So the batch ahead of you would be giving the exam at that point of time. You got it? So if batch one is giving the exam, they will be coming, say, around 9 o'clock. So once all of them go from the quarantine room to the exam, batch two will give their attendance and they will enter into the quarantine room. Okay. So once the batch one finishes the exam, they will move out of the premise, and that at that point of time, the batch two is going to start with their exam. So in no way you are going to meet anyone who has given the exam before or who is going to give the exam after you. Sometimes even after your exam, say if you have 10 candidates giving the exam in one batch, if 5 candidates have already finished their short cases, they will take these 5 candidates to a post-quarantine room. That will be a room elsewhere on the floor. And until the rest of the 5 candidates have finished the exam, you won't be allowed to leave the premise. So there is no, by the time all you 10 candidates have left the premise, the other candidates would have already started the exam or would have been in the pre-quarantine. So that is how that circle works. That's how that circuit works. So at no point you're going to meet any candidate who had already given the exam or who is going to give the exam. So there is no chance of any question leakage. So you are on your own. Whatever question that you get, you have to face it and you have to give the answer. You will not have any idea regarding what has asked or what will be asked. Yeah, that's it. And the point is, even if you feel you are very much stressed, because you tend to see a lot of faces, a lot of candidates from different backgrounds. Some are, not some, most of them are very juniors. So pretty much just out of the college or out of training. And there are candidates who are into practice for more than 10 years, like me. I thought I was the old man in the room. But then I was so happy to find that I'm not alone. There are there are a lot of other candidates as well. Some of them are giving for the first time, some giving even on their third or even their fourth attempt. So people will have different levels of stress. They have different ideas about the exam. And what I personally say is your focus should not be on what others think or what others say or what others do or what experience they share about the previous exam. No, that is not what you are there for at that point of time. You can take it up before or after your exam, but on the day of I'm just talking about on the day of exam, the time of exam. Your point is just to give your best. That's it. I just focused like that. I know I was, even when I was facing the exam or the day before the exam, on the day of exam, I know I was very underprepared. I felt I was underprepared, but maybe Nasil and Sangeeta would have different statements on that. But my perception was I was underprepared because I couldn't finish the way I planned. Okay. So the thing is, you are not there, whatever you are going to discuss, because this is not a straightforward theory question or nothing like that. This is about discussing what you do every day, what you see every day. Only there are certain aspects like in perio, prosto, implant, and a little bit of ortho, that's something which is very strange to you and which is very new to you. Especially people who have trained from India or say from Pakistan, the type of training that we get, you just tend to, the main purpose of this training or this learning is trying to learn the way it is being learned by a British graduate. Okay. So how you approach a thing, because what they look at is basically whether you are able to take a proper history. So they will give you a history. So, but obviously they will mark some things out of the history. So that is whether you're picking up the right things from the history that they have already omitted. Okay, so they're assessing your history taking skills there. Then regarding your examination skills and whether you are giving or asking for the right investigations, say for the right X-ray, or rather than just fooling around, just goofing around. No, they just want to know that if you are asking for CBCT, why you need a CBCT. Because at a specialist level, you are expected to justify why you need a CBCT. It is not because CBCT is available. No, that's not the way it does. And in most of our practices, yeah, okay, if you can't get something, okay, then we will take a CBCT. No, that's not the way it does. Why you take a CBCT? Because you have to justify, like, based on what guideline, and for this particular case, why I am going to advise a CBCT. So whether you are picking up the right investigation, and then based on whatever artifacts you have, or whatever the investigations, whatever the results you have, whether you are able to comprehend that. Especially this comes in long cases. I'll come to that. So how you are going to individually analyze all these investigation results, and based on that and the history, what conclusion you're going to make, what diagnosis you are going to make, and on what basis that diagnosis is made. So being an endodontist, there is no question of getting the endodontic diagnosis wrong. Then you are out of the game. So that's why I tell you, apply this in your practice. So many of us know, especially our specialty is a very, very, very confined specialty. Whatever be the diagnosis, or whatever be the problem, at the end of the day, it is root canal treatment. Yeah, there are surgery and different parts to that. But at the end of the day, it's all about root canal treatment. That's a one definite treatment that you are giving 99% of the time. So everybody knows that as well. But you start applying your diagnosis, because your diagnostic skills matters. Why, on what basis you came to that diagnosis, stick on to that AAE. There is no question of getting the endodontic diagnosis wrong, even if in perio and other, yeah, they might weigh little bit, but endo, no. So for example, in one of our long cases, we had a full mouth case. There were a lot of teeth. I think maybe around 10 or 11 teeth which had already undergone endodontic treatment. They're given an OPG. They have given the vitality test and stuff. So with lesion, without lesion, symptomatic, asymptomatic. So the examiner asked me all the teeth. What is the pulpal diagnosis? What is endodontic diagnosis? So, starting from one end to the other. So there is no chance of making the endodontic diagnosis wrong. Okay, so that is coming to the diagnostic part. Then one thing we always tend to miss is the prognosis. So once you have a diagnosis, and once you have formulated a treatment plan, and you know the treatment plan, how you formulate it, and you give what is your preferred treatment and what's the alternate treatment, and you as a specialist, you should be able to tell what the prognosis is, because they are looking into the prognosis. If you miss the prognosis, yes, you miss one aspect. And prognosis is also important, because these are the small things that we tend to omit in our day-to-day practice. So that is where the change comes. So if you feel that the prognosis is hopeless or prognosis is poor, obviously you have all the right to refer it for an extraction or whatever it is, even if however the patient demands. No, I want to save it. I want to save it. Yeah, in practice, we may be telling, yeah, we can do some heroic treatment, but it won't stay for long. No, but that's not the way it works. So prognosis is very important, actually, because this was one thing I often used to omit. But with repeated practice, okay, it just got to come back to me whenever I used to discuss my case. And obviously follow up, because usually most of the time your mentors point out, you tell, because that comes up with the question, what follow up would you recommend and why? When they ask what follow-up, always expect the question why. Why you decided to call for a 3-month appointment, why you decided to call for a 6-month appointment, or why follow-up, and why 1-year follow-up. Because my examiner asked me this when I told a 3 months follow-up. He asked me why. So maybe he might have had a different answer or opinion in his mind, but my answer justified why I calls for a 3-month follow-up. So those are the different aspects. to that. Yeah. And the same with short case and long case. But short case, you won't get much of a time. Actually, I was more worried about long case for the exam because I was worried whether we will get enough time to write and document all the findings and formulate a plan. But long cases, yeah, even for me, long cases was difficult. But most of the candidates tell that short case is difficult because short case comes out of a blue. You don't know. You don't have time to think also. Yeah. Hello. Can you hear? I think this is stuck.
Yes, it's fine.
Yeah.
Any other questions? Anything you would like to ask?
What would both of you recommend to study in the last 1 week? Like the webinars only, or anything else? Like the last few days.
Ruti, for me, nothing much happened during the last 1 week.
Basically, travel
Yeah.
tensions, right? For Dr. Khalil.
Yeah. So I think during the 1 month before your exam, I would suggest that you should go through your notes. Whatever you have gone through the webinars, that is must that you should have gone through the webinars because there are very, findings, precise finding which have been mentioned already in the webinars. So you should go through the notes, and I would say don't go through the new stuff in the last 1 month. Just repetition of the same content is very important because by the time 1 month before the exam, it felt like it is already, have inculcated those qualities and all those preparation techniques like following the diagnosis, then going through the entire template treatment plan, all at the same time you have to write the maintenance, everything. So just go through the basics, that is regarding endodontic, like Dr. Khalil mentioned, that there is no scope that we could go wrong with the diagnosis. So just go through the basics of our endo and the I think the evidence based, that is like for example, the revascularization, open apex surgery is very important. So they would expect that you should know some of the names of the authors, and it would certainly add up extra points that you have been aware about this paper as well. So even while writing your papers, they would sometimes in the written paper also there would be questions that write it and quote the evidence. So it would be difficult for us to remember the exact the year or something, but I would still suggest that write the few things which are most commonly asked in the endo, so that you could be to the point while answering them. And coming to the point that you asked the question, I would suggest that go through the endodontic basics, that is what commonly we expect in our day-to-day practice, trade treatments, like they would be asking about the instrument retrievals or ledge bypass. So all these things which we daily do in our practice, that is something you should be able to explain with what technique you follow or what armamentarium you would be using. So all these things that you do daily, that is must. And for perio, I would suggest that you should go through the classification because they are very much into the basics. And sometimes you would be talking about the prognosis, Kwok and Keaton, this is the favorable, this is prognosis is good and everything nice, but then they would be again telling you that, okay, tell me what do you know about the BP scoring number 3. So that is something very basic that we should be knowing. And we know all the advanced stuff, but we would be taking some 1 minute to grab that, okay, 3 is actually having this score. So I think you should just revise all those basic points, the BP scoring and all the classification, because they do ask that according to you what this classification stands for. And there would be multiple findings in the long cases. So like you would have been taught in the training, so I would say that just go step by step. Whenever you go through your feedbacks, what I did in last 1 month, I used to go back to the feedback. For me, webinars, I would have already had all those points with me, so I would just read those points whenever I feel like not doing anything. but just keep on hearing what the feedbacks they have been giving you. For example, they would be asking you to take a pause in between, or just be sure that you don't forget the prognosis. All these things help us that we don't repeat the same thing again. So I used to revise the feedbacks again and again. I used to go through the notes. And for the prosto and resto, I think you can just go through the RPD designing or the FPD. And I think, like I said before, that rather than going through the volume of the content, lately I would see that no, you are already an experienced clinician, so you would be able to identify most of it. The only thing is that the written part, and the main thing is that just follow the template, the basic things. That's it. I think that should be helpful to you, because many of the colleagues of mine who used to be an experienced clinicians along with me, they were telling that they found it difficult while coming up to the conclusion, or while talking about the treatment plan, or sometimes they used to feel that they are not able to the examiner is not accepting their answer. So like I mentioned, just you can always say that, okay, I would try to I understand what you are trying to say, so based on this my answer would be this. You can always justify rather than defending your answer. That's what I mean to say, rather than getting into the different kind of conversations that they had in the exams. It would, like, most of the time would be just went away or vanish in that conversations. Just try to answer as many questions as you can, because sometimes some examiners keep on rolling around the same question again and again, and if you're still stuck into the diagnosis in the 15 minutes, then you have lost the entire case. So try to reach to the maintenance phase or finish it till the treatment plan at least.
Okay, I tell you how I approached. Once you enter the exam, so okay, I'll tell you how the exam runs. I already told you about 10 candidates who are going to sit the exam. There will be 10 rooms in one corridor. So each room will be having 2 examiners. Okay. So initially, all of us will have a seat right outside the door. So when it is time, they will ring a bell, and each candidate will go get into each room. So from the point of you entering the room, just make a very pleasant, say good morning or good afternoon or whatever it is, and make sure that you are just there to discuss the case. Yeah. You're not there to give the exam. You're just there to discuss the case. You can expect all sort of like surprises from the examiners. Some are very kind. Some are like some they give you a very strange face. Uh, some will really try to help you come up with the answer. Um, some they don't care whatever you say. So uh, I'm not sure whether they do it. I mean, purposefully, because they may be looking at how you um, say for example, patient can also behave very indifferently, right? So even if the patient behaves indifferently, how you take care of the patient with calm and composure, that's also important. Right from the moment you enter the room, just if it is a good morning or good afternoon, just be very pleasant. They will offer you a seat, you can sit, and then they will just give you a brief. Okay, today we are going to start with the short cases. You will have 4 short cases. Each case will have 7.5 minutes. We will ask you the question, and shall we start? Then they will ring a bell and they will start. Okay, starting with the case 1, and probably you will have either a photograph or a radiograph there, and 2 or 3 sentences about the case. Okay, and they will read that case for you as well, and you can also look into that. So my way of approaching is, once you have a photograph or radiograph, what I always take back in my mind is, okay, I have half of the marks is already with me, because I know they are going to ask you to describe about the case, describe about the image, or describe about the photograph. So that is what your Viva is very important, because every Viva session, you don't know. You are giving approximately 11 Viva sessions every week. Then you're also giving a lot of mock exams. So every Viva session, you are seeing different photographs and different radiograph, and that is what you unknowingly you are rehearsing. That's what your trainers are training you for. So I already know half of the marks are with me. So my only focus is to find out what they want extra and how to score that. So that is how I used to approach. Okay. So I always pray. They ask me to describe the radiograph or describe the image. So that's where I go full firing. Okay. So that's the first impression you have already set in. So the examiner will already know that, okay, this guy knows how to read the X-ray or how to come up with that case. So he's make sure that you give attention to all the detail. Don't miss up on anything. So for example, one of the long cases had an angular cheilitis. It was not mentioned. It was just mentioned that patient had a loss of vertical dimension. There was angular cheilitis. And I don't know, I had a question from that as well, but I already mentioned that. So they told, what are you going to do for that? So all the tiny details, if you explain to the maximum, yeah, half of the job is done. Then they will point to that specific question that they want. From there, they will take it on. So this thing has to be repeatedly practiced, and practiced. Just like revision, the practice about this aspect has to be done. So you already are in the game. And if you don't know, if you can't find, sometimes they will just keep on asking the same question. So they just want to, they are not there to fail you. They are there to make you pass the exam, but um, they want a specific answer for that. So for example, if for a pulp capping or pulpotomy, I told MTA. So he told, why you want to go for MTA? I told the advantages of MTA. So what is the disadvantage of MTA? I just told discoloration. But then they told, is there any other disadvantage? So my brain started getting fogged. So my focus was on like what this guy really wants rather than what is the other disadvantage of MTA. So don't let that shift. But luckily he was a very good examiner. So he told, have you used MTA? Have you mixed it? So sometimes they will give you clues to get to the answer. So then I know. Then I told, okay, for this case, I prefer to use a bioceramic or a biodentin. So he was asking about the setting time. Got the point. So rather than getting your attention shifted to what he wants, you should always try to keep focused on what the answer is. So if the examiner is not a helpful kind, there are examiners, whatever you say, they just give a flat face to you. They won't nod, they won't say yes, they won't say no, they won't move to the next question. So even if you know that you are blundering or bluffing, they will not give any clue as to you are giving a wrong answer. So you can expect all those at the exam. So that's why I told you, don't make any guess. If you don't know, it's a no. And that's not a problem. That's not something wrong. I have told multiple times, I'm not exactly sure about what it is. So they will automatically move to the next question. And the pattern, what I found is, even if you don't know one question, or if you can't answer one question, but if the examiner feels that this candidate knows that, and at this particular point of time, he cannot tell it, he will move to the other question and he will come back to that later. And he will give you 3 chances. This is a pattern I have noted. And it has worked, because you may forget some point about some material or something at that particular point of time. But once the discussion has progressed further, then you realize that, oh, this is what he was asking about. At that point of time, they will come back to that question. So that is how seasoned examiners are. Yeah. Anything else? Nasil, when it is time, just let us know.
Yeah, we will see if there are any further questions. If not, we can wind up. Dr. Amina, are you here? Anything you would like to ask?
Amina is already at the exam.
No, lot of information. Thank you so much, Dr. Kruti and Dr. Khalil. The scoring system, I've heard, is they take the average of how everybody else does, and that is how it is scored. Is that something we know of?
See, there are variables that you can handle. There are variables that you cannot handle. So those are the variables that you cannot handle. So there is no point in thinking about that. The point is in giving your best shot. That's a very simple answer to that. Yeah, because even I had that thought. So I was telling, the thing is, you are wasting your time on looking at how others are performing. If they perform well, will I be underperforming? No, that's not the way. That's not what it is about. It is about you giving your best. So that's it.
Yeah. Thank you, Doctor.
So when vivas are conducted, like should we like quote the authors like for for not it's not possible to quote authors for all the questions, but do they ask specifically?
See, there are certain quotes, or there are certain authors that they normally expect for us to quote. So because even I was also very poor in retaining the names and numbers. But there are certain set of authors that you have to quote. They expect us to quote, but not everything. And in one of the short cases, even though I quoted the most relevant one, there were other couple of authors who were closely associated with that particular case. Even though I knew the answers, names, I wasn't sure, but I didn't mention. But later on, as the case progressed, they asked me, have you read any other papers about that? I told yes. And then they will specifically ask you. So the point is, there are certain sets of authors that you have to quote. And just like I mentioned about the endodontic diagnosis, there are certain things, especially from the guidelines, that you should have a good idea about, that you cannot omit. Yeah. Rather than that, no, they don't expect you to quote each and every sentence, and you will not get time for that, and you are not going to do that. Nobody is going to do that. Yeah.
Yeah, but if we like quote a specific author, will they like ask about the study, about the article, like like rat study example? Like you have to like, will they ask like, okay, just tell me a brief the article? Will they say that?
First of all, this is not like an MDS exam viva, where you sit 1 hour in front of each examiner for a long batch. No, this is very time specific, and they don't have time for that actually. So their point is to discuss about the case and whatever is relevant about that case. Because when you justify, you have to justify based on evidence, right? So what is the best evidence available for that? Yes, you have. Say I'll give you an example. Like if you're talking about vital pulp therapy, there are papers from those many people. So they expect that from you, only that. And they won't ask you what was written in that paper and what was the finding. In my experience, no, they don't have the time for that. Yeah. Viva question is not the same for everyone. It depends upon how you take the examiners along.
One person writes, Dr. Kruti, right from day one, we knew he's going to clear, and the other person is like, he'll wait till the last minute to do, and somehow, or he has certain within him, but he doesn't show it out, and then he's going to give his best on that day. That's how it was, because even without writing any mocks, like which you had to send me, you didn't do that, and I was also worried, he's like, how is he going to do the written paper without any practice and all? Like, I was tense. Finally, both.
That is why this session is very unique.
Yeah.
We get to know from two candidates who have prepared totally in a
Completely
different way.
right on opposite extremes.
No, that's what I told you, because especially people who have been into practice for a long time, especially those people who are not associated with any active academia, like in the college or nothing, they feel very unconfident or very doubtful about giving the exam, because whether this is going to work, whether we can compete with people. No, the thing is, you don't know that you already carry a lot of experience with you, and that's what keeps you a bit different from the freshly passed out candidates. Is it right, Kruti?
Exactly. That's what I was going to say,
Yeah.
that
Yeah.
for you might be feeling that you are a bit underconfident since you have not been in touch
Yeah.
with the academy. But at the
Even
same
he brings down the confidence we have in him. Like, he's like, no, I'm not going to get And that's what
Yeah.
he does quite often.
But at the same time, I think freshly passed graduate would also be having the same underconfidence that, sitting next to the um, internationally claimed clinicians and so much experience in this field, they would also be feeling intimidated by sitting next to them. For me, it was like that. I felt that I'm the youngest one being around all the experienced clinicians. So it's like everybody is going to have their own hiccups and own barriers within their mindset. So it's better not to think in that direction that I don't have the experience, or maybe I'm not good at that or good at this. It's better to just have that confidence in your preparation, because since you must have put a lot of efforts in that preparation. So I think the two contradictory is that even though you had some time, so you had your experience as a strength, which is going to help you to navigate through the cases. For me, I had to practice a lot of cases. I have to go through a lot of the content around to just get those experience which you would have claimed from over like past 10 years or 15 years. So you already have those strengths with you. So everybody is going to have their own strength and weakness. So I think it's better to just try to, stay calm and composed during your weak part and try to overcome that. At the same time, just try to strengthen your strength a little bit more. So that is going to help you. And one more thing I wanted to add before was that to the previous question, which was asked about the evidence based, I think I had completely different experience with the examiners. I had totally UK based examiners in my exam, and I believe that most of the examiners from the UK, they do have this approach for the evidence a lot. So they do ask that, what evidence do you have to quote for this? By saying this, I don't mean to procure each and every evidence you should be having on the tip of your tongue. No, not like that. But you should basically know the, let's say if they ask you what would be the successful outcome of this root canal procedure, then you should know that there is a paper by NG et al, okay, or you should know that there is a ESC paper which has been provided. So even though you don't name the authors, you should know that such paper does exist. And after that, if they ask you that do you know the authors, that's fine. You can just dodge that and say that no, I could not recall. Can we please move to the next question? So just talk whatever, even if you know that, oh, I know this based on the ESC paper come in 2006 or something like that. Just talk about a bit so that they know that you are aware about a paper, but you don't recall the name, because it's something that we are all humans, so it's not something that we would be having the name of the authors on the tip of the tongue. But how you will manage the patient, that is what they want to know. So there would be small things in each and every line. So just try to go through each and every line, be very focused in the long cases, especially when they are mentioned. So go through the step by step, chief complaint, past medical history, dental history, because every line is important. Every line would be having some or the other cue that would help you to answer, and there would be some or the other question from the medical history or dental history. So that is how they start initially. And if you have already, like Dr. Khalil mentioned before, that if you have already passed those bridges, diagnosis, findings, you are already halfway through. All you need to just give your treatment plan, which is your strength, because you all are experienced clinicians. So it would not be tough for you to reach to that level.
Okay, I think with that, we could wind up today's session. We planned for 1 to 1.5 hours, and it's like almost 2 hours now. So I don't think there are any further questions, and hopefully we can wind up today's meeting. So we would like to express our sincere thanks to Dr. Khalil and Dr. Kruti for sharing the valuable insights and experiences from the recent exam. And we would also like to thank you all for attending this webinar, okay, and being part of this event, okay. Thank you all, and have a good night to you all.
Thank you,
Thank you.
Dr. Khalil.
Thank you, doctor.
Thank you.
Thank you, doctor.
Thank you for having us. Thank you for hearing all our blunders and mistakes. And I hope the session would have helped you. And it was very nice to have met Kruti also at the exam. And if you guys need any help, you can call reach out to us. So be it how you prepare for the exam or any materials or anything. And probably we won't have to offer much more than what Sangeeta and Asil have already offered. But still, because both of them, they are pretty busy. They have a lot of candidates. I know how much limited time they have. And the good thing I found about them is even if it is day or night, we could freely interact with them.
Yeah.
If you throw a WhatsApp message, they will respond very promptly, and this doesn't happen usually with all. Yeah, so that's one good advantage that I personally. And yeah, I know you all will do well, and the journey for you will also be very enjoying. And wish you all the good luck.
Best of luck to each and every one of you. Hope to see you on the other side very soon.
Thank you, doctors.
Bye bye. Good night.
Thank you. Good night.
Thank you so much.